Hey everyone, welcome back to the channel. Today I'm diving straight into a fiery political battle brewing in Congress over billions, yes billions, of unspent COVID cash. So, what's the fuss? Senator JoniErnst wants that money sent straight back to the Treasury, but Senator Ron Wyden's having none of it. Let's break down what's really going on here. JoniErnst didn't mince words. She says, look, the COVID emergency, over. That means the emergency spending should be over too. She's especially fired up about those Obamacare subsidies that ballooned during the pandemic. According to her, they were never meant to last forever, and it's time to hit rewind, returning them to what they were before COVID-19 hit. Healthcare costs went up for everyone, she points out, and she wants a bigger plan to bring those costs down for all Americans. But here's where it gets wild. Ernst is waving around a Government Accountability Office report that says $65 billion in COVID funds are just sitting there, collecting dust. She calls it slush fund money, leftover dollars that Washington is just itching to waste. And some of that spending? Pretty questionable. Ernst highlights projects like $1.8 million spent on feeding alcohol to monkeys to study COVID effects. Yeah, you heard that right. She's got the receipts. Leftover cash is tucked away in all kinds of federal accounts. Media, Smithsonian Museum interior, library with bookshelves, school classroom with laptops, International Broadcasting Studio, HHS headquarters, USDA office, museums, library services, education tech, International Broadcasting, HHS management, USDA marketing, even a State Department science bucket. Ernst says she's found 82 separate accounts swimming in leftover pandemic money. Her solution? The Returning Unspent COVID Funds Act, a bill to claw every last dollar back to the Treasury. Ernst took her shot, asking for unanimous consent to pass her bill. No debate, no delay, just send that money home. But then, Senator Ron Wyden jumps in and slams on the brakes. He objects, saying, hold up, this isn't just leftover cash. Some of this money is actively fighting real health threats, like Ebola outbreaks. Wyden argues these funds are the backbone for medical supply chains, vaccine research, and keeping our emergency healthcare workforce on standby. He insists, if we're going to make changes, do it the right way, through the regular funding process, not a fast-track bill. So with Wyden's objection, Ernst's bill is blocked. For now, those billions are staying put. But here's the big question. Should Congress claw back unspent COVID billions and send it back to taxpayers, or does it make sense to keep those funds ready for the next big emergency? I want to know where you stand. Drop your thoughts in the comments. And if you love sharp, clear political breakdowns, make sure you hit like, subscribe, and turn on notifications so you never miss a video. Thanks for watching.
Mr. President, the COVID pandemic is over, and the emergency spending spree should be over too. The COVID-era Obamacare boosts were temporary, and now those temporary benefits are set to return to pre-COVID levels, exactly as the law intended. These emergency measures were for an actual emergency, not a forever program, and definitely not a backdoor expansion of Obamacare. Healthcare costs increased for everyone during the Biden years, not just those with Obamacare. We need a plan that brings down healthcare costs for everyone. In addition to ending the emergency spending spree, as the law says, we need to claw back every last COVID slush fund dollar before Washington finds a new way to waste it. There are billions of dollars still sitting in the U.S. Treasury with "for COVID" written on them. This summer, the GAO, the Government Accounting Office, identified $65 billion, that's billion with a B, still in COVID slush funds. Let's close the book, return to reality, and give taxpayers the accountability they've long demanded. Because yes, their hard-earned money ended up paying for binge drinking monkeys in Oregon. What? I see you're all saying, what? It is unbelievable, but it's true. The Oregon Health and Science University raked in more than $1.8 million for this. In one study, monkeys were fed 8 to 16 alcoholic drinks a day to see how their chronic boozing affects COVID-19. Taxpayers didn't sign up for that, and it's long past time we put a stop to it. Let me also give you some examples of unspent COVID funds. $3 million is sitting in an account for museum and library services for COVID. $390 million for USAID's Emergency Connectivity Fund for Educational Connections and Devices. USAID is no more, so these millions should have been returned to taxpayers yesterday. $4 million for international broadcasting operations at the Millennium Challenge Corporation. And I challenge you to find any American on the street who would want their tax dollars going toward COVID funds for international broadcasting 6 years after the COVID pandemic. $389 million in COVID funds sits unspent for an HHS program management, and I think they've managed COVID enough. $1 million for USDA's marketing services. USDA. I can tell you that Iowa farmers would much prefer these funds be put toward a better use. $1 million for an account that just simply says science at the State Department. Okay, so let me tell you, my friend Secretary Rubio is holding down a lot of different jobs, but science, let's give that COVID science money back to taxpayers. And those are just a few examples. I've tracked 82 program accounts. 82 program accounts with remaining COVID funding. My Returning Unspent COVID Funds Act is very simple. The COVID pandemic was 6 years ago. It's past time for the unspent COVID funds to be clawed back. Let's pass my bill and send these funds back to the Treasury. So, Mr. President, I ask unanimous consent that the Senate proceed to the immediate consideration of calendar number 266, S3166. I further ask that the bill be considered read a third time and passed, and that the motion to reconsider be considered made and laid upon the table.
Is there objection?
Reserving the right to object.
Senator from Oregon.
Mr. President, I'm going to make just a few brief points in response to Senator Ernst's proposal. This bill would rescind each dollar of unspent funding from emergency supplementals, including funds America needs to prevent the spread of infectious diseases. For example, the Trump administration is using this funding right now, that's right now, to address an Ebola outbreak. Rescinding this funding makes America less safe. The point of the Rapid Response Fund is to have money in case there's a need for a rapid response. This funding can save lives. This bill would further rescind funding for medical supply chain development, manufacturing, and production to develop products like a universal flu vaccine to prevent the next pandemic. And it would rescind funding available to build a stronger healthcare workforce for nurses and diseases specialists who can address emergency interventions. I want to say to my colleague, we've always worked well together, that I'd be glad to work with her and other colleagues to have a comprehensive look at what should and shouldn't be rescinded because of the discussion we've just had. That's something that should be done as part of the appropriations process, not, in my view, through this legislation. For that reason, Mr. President, I object.
Objection is heard.